Hi, this is David Villar, and welcome to this presentation that will address therapies for one of the most common reasons why dogs and cats are presented to veterinary clinics. Just like it happens to any of us, dogs and cats are going to develop diarrhea episodes in their lives at some point in time. We're going to see it sooner or later, and it's just a matter of time when and where it will happen. There are just as many therapies as reasons why pets develop diarrhea, and this is evident when looking at the huge number of diets that are now available to treat gastrointestinal problems. And the same can be said for probiotic medications that are indicated to replace the normal gut microflora. So, as you can imagine, finding the actual source of the animal's problems and getting to the bottom of what's going on is going to be the best guide to decide what's best to do in each situation. So, if in the previous video we talk about the approaches to make a diagnosis, here we're going to focus on the treatment for the most common causes of diarrhea. And because of the source of the diarrhea could always be an infectious organism that may be potentially transmissible to people, any dog and cat with diarrhea should always be suspect of having a zoonotic disease until it's proven otherwise. So we have probably all heard about salmonellosis, and that's just one type of bacterial infection that is transmitted from animals to humans. And what we don't usually think of is that we can also pass on our infections to our pets. So good personal hygiene habits go a long way to prevent that transmission from ever taking place. So diarrhea is one of those conditions that has always been treated empirically without real evidence of what's truly going on, and it's probably one of those conditions for which there are more treatment protocols that lack medical support. And for example, based on absolutely nothing, the bowel needs to rest to restore its normal function. So the practice of withholding food for even 24 hours may actually be worse because the rapid turnover of that mucosal epithelium needs a constant supply of nutrients that are going to come from food. And this has been proven particularly in scouring baby calves, and it's no longer recommended to withhold milk that provides all the essential nutrients and calories that sick calf requires to get back to normal. So the bottom line is that unless the animal has severe vomiting, it may not be wise to upset the animal even further by fastening. Now, another misconception is considering a highly digestible diet as a bland diet. Chicken and rice only are deficient on many things. A highly digestible diet are usually those that we want to reach out in cases of acute enteritis, and they don't really require the action of bile and pancreatic secretions to be absorbed. For example, they usually replace the long-chain fatty acids with medium-chain fatty acids. They also have antioxidant and omega fatty acids, and they tend to provide all the essential nutrients. So if you plan on using a bland diet, just remember that it should probably be done for no more than just a few days. As we will discuss later on, most veterinarians prescribe antibiotics for dogs with acute diarrhea. And this is really alarming because they should not be considered as a first line of therapy. And probably nutritional management, deworming, probiotics, maybe with a few some anti-diarrheal agents is probably all that we need for acute cases. Another old wives' tale is considering chicken as a hypoallergic diet. It may not have as many allergens as beef or dairy products, but it still may cause food sensitivity. And finally, there is recent evidence showing that probiotics have pretty convincing effects restoring the gut microflora and helping that animal getting off the toilet faster. However, as we will see, there are many over-the-counter products with very little oversight and no really quality control studies. So unless their claims are supported with research, you probably want to stay away from some of those generic products. So again, the principles of therapy should Always follow a complete workup so we can design the treatment to match the right condition that causes the diarrhea. And this can be sometimes quite challenging, particularly for cases of chronic diarrhea. Even though the things that can cause acute and chronic diarrhea can sometimes overlap, the initial therapeutic plan that is usually taken for each one is usually different. And in many occasions, we're going to reach a diagnosis by exclusion and response to different therapeutic trials. So we're going to begin with this big old dog, which has had diarrhea for 3 or more weeks. And if we take a look at this diagram, the majority of chronic cases will have an origin within the intestines, and they could be either inflammatory, infectious, or neoplasias in that order. We're going to discuss the most common ones, which are the inflammatory and infectious situations, in more detail on the next few slides. But just keep in mind that there are differentials like lymphoma. That's probably the most common type of neoplasia, which fortunately responds better to chemotherapy than other types of neoplasia. And probably the prognosis on this one is going to depend on how well the animal responds in the first weeks of therapy. And there are also diseases that are outside the gastrointestinal tract that can also cause chronic diarrhea. The most common one is probably pancreatic insufficiency, which usually responds well to oral therapy with pancreatic enzymes. And in this secondary group of causes of chronic diarrhea, you obviously need to treat the underlying disease first if you expect that diarrhea to go away. We could also include in this group things like diabetes, hyperthyroidism, adrenal insufficiency, but as I said, probably the most common one is pancreatic insufficiency. So if we focus on the most common causes of chronic diarrhea, the number one falls into different types of inflammatory conditions. And within this group, the most frequent one is food responsive enteropathy in about 60% of the cases. And the way to diagnose this type of is by doing an elimination or exclusion diet, in which we basically replace the original diet by either a noble or a hydrolyzed diet. By noble, we mean something that was not fed previously and that hopefully will not have the offending component of that original diet. And if it is a diet responsive condition, most animals will get better in about 1 or 2 weeks, which is much shorter than what we would expect for allergic skin disorders. That may take up to 6 to 8 weeks to respond. And hydrolyzed diets are those that in which proteins have been broken down into small peptides of about 6 to 15 kilodalton. Which is below the range that will be picked up by the immune system as foreign antigens. And the other less common types of inflammatory enteropathies are the antibiotic and the immunosuppressant responsive ones. The first one, antibiotics, is unclear because there is no single bacteria that has been identified. And the speculation is that the syndrome is caused by an overgrowth of many different types of bacteria. And there is also some predispositions, like in German Shepherds. And usually the animals are going to respond well to either metronidazole or tylosin in a course of about 1 to 2 weeks. So finally, if therapeutic and antibiotic trials do not resolve the situation, the next step would be a protocol with prednisone for several weeks. And if this doesn't work, or you're too concerned about the side effects of corticosteroids, it's been shown that cyclosporine works really well in these cases of inflammatory bowel disease. So you may want to try that one instead of prednisone. So as you can see, in all these cases of inflammatory bowel disease, the cause of the enteropathy will be an exclusion diagnosis, in which you basically systematically go one step at a time, ruling out the different possibilities that may underline the problem. And the one thing to mention is about inflammatory bowel disease is that there is a genetic predisposition in certain breeds, like the German Shepherds. There has been research showing certain mutations in proteins of the immune system, like the toll-like receptors, which makes them more susceptible to develop inflammatory bowel disease. So when we have a dog that comes into the clinic with chronic diarrhea, it may be worth looking up if it's one of those breeds that may be genetically predisposed. So this is the kind of roadmap that can be followed to diagnose chronic cases of diarrhea. For some of the causes, there may be a specific test that can be used, particularly for the secondary types of diarrhea. But if I were to ask you what important category are we missing here in this diagram, what would you probably say? If you take a look closely, the parasitic ones, we haven't mentioned anything, and they would tend to follow within the infectious categories. And in this group, we have the whipworms, the roundworms, and the unicellular parasites. And because fecal testing is quite simple to do, it should always be part of a diagnosis workup to rule out these parasites. Now, the classical drug to deal with the big ones is usually fenbendazole for 5 days. For Giardia, metronidazole is usually the first line of therapy, but fenbendazole will also target this organism. So if you were to have, let's say, a co-infection with roundworms and Giardia, that would probably be the drug of choice. For Cryptosporidium, the drug of choice appears to be azithromycin. And for Trichomonas, you can go with either metronidazole, but sometimes the only drug that has been really effective is ronidazole. And finally, for Coccidia, you can either go with metronidazole or poniazuril, which is the active ingredient of Baycox. So as we mentioned at the beginning of the presentation, there are a lot of different commercial diets that should be part of any protocol to treat gastrointestinal conditions. And this is really a topic that there is overwhelming amount of research and development. So here I will just say a little bit of the different types of diets that are now available. When creating a nutritional plan, there are things that should probably be bear in mind. Could nutrition actually be the cause of the disease? What is the effect of disease on nutrition? Is the animal losing weight because it's unable to absorb nutrients, or is it losing nutrients into the fishes? Maybe it's an excess of nutrients that cannot be absorbed and are responsible for the diarrhea. And finally, could there be a deficiency of nutrients that in of themselves are important for the normal function and regeneration of the intestines? So let's address these diet issues for cases of chronic diarrhea, and then we will see them for acute diarrhea. Now, until you have a definitive diagnosis, you can try changing the diet in cases of a small bowel diarrhea, hoping that it will be a food-responsive enteropathy. And we already mentioned the hydrolyzed and noble diets. Now, when the diarrhea is originating from the large bowel, we can try with a diet containing high fiber, ideally a mixture of soluble and insoluble fibers. If we were to define fiber, is made up of a complex carbohydrates which cannot be broken down by mammalian enzymes. For example, cellulose, they make up the plant cell walls. And in that respect, they are obviously not essential for dogs and cats, but because they bind nutrients and may reduce their absorption, the downside of fiber is that the animal may not get enough calories and will need to eat more. So the reason why the fiber is beneficial in cases of colitis is because some of those sugars will ferment in the colon and produce small chain fatty acids like butyric acid, which is a good nutrient for colonocytes. And by lowering the pH of the colon, they also tend to increase the amount of the good bacteria and decrease those that can cause diarrhea, like Clostridium. And the other effect of fiber is that it can normalize the transit time by changing the motility. So in cases of diarrhea, it will probably prolong the transit time, And if there is constipation, it may do the opposite, that is shortening the transit time, and it does so by increasing the fecal bulk, and that tends to stimulate defecation. So when we refer to prebiotics, fiber would be one type because it favors the proliferation of the good bacteria in the colon. And if we were to say a few things about probiotics, there is new evidence suggesting that it should probably be part of most protocols to manage GI disorders. There are a lot of convincing effects that they lessen the duration of diarrhea in many situations, whether it's an acute or chronic cases, or a large or small bowel diarrhea. Probiotics are basically a culture of live bugs that are supposed to outcompete the bad guys in the intestines, and they also seem to enhance or stimulate the local immune system. I will not say much about probiotics here, except that there are many different ones on the market with no quality control studies that support that they have any clinical benefit. So you may want to check what has been done to prove that they actually work and meet their label claims. And in this study that was in the Canadian Veterinary Journal, they found that 4 out of 15 products that had specific claims of viable organisms only met or exceeded their label claims. So this is something that we should probably be careful when we choose one or another. So finally, let's say a few things about treatment for acute cases of diarrhea. Most of the times, acute cases of diarrhea are self-limiting, and whenever the thing that causes it runs its course, they tend to resolve. So in these cases, the idea of treatment is usually helping the animal having that diarrhea go away faster. And the first two that we listed here, the motility modifiers, loperamide and difenoxylate, these two tend to work by increasing the segmental contractions, and that will obviously constrict the size of the intestinal lumen and slow the movements of feces along the GI tract. And what happens in many cases of diarrhea is that the bowel loses its smooth muscle tone, and usually the decrease in segmental contractions is greater than the peristaltic contractions, and that explains the increased movement of feces and defecations that we tend to see in diarrhea. Probably the anti-secretory effects of these two narcotic drugs may actually be more important in slowing down the movement of feces through the gut. With regards to the anticholinergics like buscapine, this could be particularly useful when we have spastic and painful contractions, such as when you see an animal with tenesmus or cramping rectal pain. With regards to the anti-inflammatory drugs, they work by preventing the formation of prostaglandins, which is actually a way of counteracting the action of many bacterial toxins. Without those prostaglandins, there is going to be less secretion of fluid into the intestines. And apart from the inflammatory actions with Pepto-Bismol, there appears to be a protective effect by coating or shielding the mucosa from the bacterial toxins that may be causing the diarrhea. We've probably all taken Kaopectate at one point or another, and the funny thing on this one is that there are no really good control studies proving that it really works. And theoretically, it's a type of clay that binds toxins, and this way it decreases the secretion of fluid into the GI. What is definitely good as a magnet or absorbent for those bacterial enterotoxins is activated charcoal, which is also known as the universal antidote because it will also bind potential poisons and prevent them from being absorbed and getting into the bloodstream. The downside of activated charcoal is that it's kind of messy to administer, and that usually tends to deter people from using it. Before I finish, I wanted to point to this one study that was conducted among British veterinarians in their habits for dogs with acute diarrhea. The results show that 71% of 371 dogs got antibiotics for acute diarrhea. And if we read the conclusion at the bottom, the frequent use of antibacterials for acute diarrhea is surprising and somewhat alarming. There is evidence that resistance to antimicrobials is increases among bacteria isolated from pets. Nutritional management, therapeutic deworming, and probiotic therapy, accompanied by in some cases by antidiarrheal agents, should be considered first line of therapy. So just remember that for acute cases, antibiotics should not be the first line of therapy or the first thing that comes to mind, and you may want to try this other alternative first. So this was my final slide. I hope it was worth your time. There are many things that we covered, and I know that many of them require more in-depth analysis. But the idea of this short presentation was just to give a quick overview that will help you design your own therapeutic plan for diarrhea. So having said this, thank you again for listening, and I'll look forward to seeing you in future presentations.